Hello friends, thanks for the wonderful response for the video on allergies. Today I shall be sharing a little bit on the various types of headaches. I have been very fortunate to have very good treatment experience for headaches. Primarily there are 6 types of headaches that we have seen. The tension headache, the migraine headache, the rebound headache, something called as a cluster headache, sinus headache. Have I missed anything? So these are the various types of headaches. On last is the hormonal headache. Yes, 6 types. Each one has a different treatment pattern, and not much of things can be done at home, but a little bit that can be done with relief, because most of the patients already try things out. The first one that I'm going to share with you is called the tension headache, like I shared with you. Most common type of headache, which generally is, people think it's migraine, but they are called tension headaches. More often they are, what I have observed, they are in the back of the head and the neck primarily, and they are not generally associated with vomiting, etc. The common treatment pattern that will help for this is I think stretching, a warm compress, but I have found sometimes even cold compress. These are the common things in the house that can help you. The second one is the most common one which people come up with, like the migraine headache. Migraines generally were one-sided, but now we don't have a two, it can be one-sided, two-sided also. And important thing is that it is associated with some digestive connection. There is nausea, there is vomiting which can or cannot relieve, and you may have something called as an aura, that is before the headache a feeling person gets that I'm going to get it in the eyes or in the vision or any other areas in the stomach, for example. Migraine, generally people have found they do all the things that are relieving, so I'm not going in the detail, but mint tea I have found does help a lot of patients when they have it. The third is the cluster headache. Now cluster headache I have found also comes in the night. A lot of people have suddenly wake up midnight and have headaches. Now they are very, very severe headaches, cluster headaches, and they come in cycles. There are sometimes patterns, same day, same week, etc., same time. The support treatment program for that is having cold press. I have found cold press giving them reasonably good relief temporarily, but later added with medications. We give very specific homeopathic treatment for these conditions. The fourth is another very common thing, that is the sinus headache. Now you have in the areas of sinus, that is the sinuses here, the sinuses like these are the maxillary, the frontal, and there are ethmoidal various sinuses where you have comes with along a cold, and you have pain at these areas which becomes worse when you go out in the cold air, etc. Very common type, very useful to have steam inhalation. Warm steam generally helps this headache regularly. We suggest this along with the medication. The fifth is the rebound headache. Now rebound headache are very less heard by people, but it is a type of headache which comes when you overuse painkillers, painful medications. People come to us and say they have been using painkillers, and there is a overuse, and that can cause back severe headaches. Now commonly we treat it with specific homeopathic treatment, but what you can do is gradually, once it's diagnosed correctly, we tell them to reduce that dosage of the drug that they are taking and not take that. And I think a little ginger tea also has been found to be quite helpful in such cases. Last but not the least is called the hormonal headache, where especially women who are on hormonal treatment, the hormones can stimulate severe headaches when they are taking hormonal treatment. Now what is suggested generally is to keep track that when they are on these hormonal drugs, what are the factors which bring on this, what are the trigger factors, and they should be able to avoid or reduce the trigger factors connected to this. And in these cases especially we suggest meditation and yoga. yoga generally is suggested for all. This is what I have found, but specifically for this. I have been very fortunate over my 4 decades to be able to see more than, I think, at least 1,000 or more patients connected to headaches, and we have had the privilege and reputation of being able to help these headaches which are 40 years old and 42 years old. I remember a case that had come to me. So specific homeopathic treatment for relief is what I have found, and long-term treatment, a little long-term, to be able to treat it curatively with zero side effects, etc., is what I suggest. So if you're someone who has these headaches very regularly, please contact a good homeopathic doctor with experience, and he should be able to support you and help you out. If you have any queries, questions or doubts, please feel free to contact me. I'm going to definitely help you and respond back to you. Thank you.